Mm-mm. Hello, are you all in? Patira ako. Hello, good afternoon. Yes. So I think we have to start. So last week we went into the extraembryonic tissues, and if I may repeat, there are 4 tissues that we included in our discussion. Number one should be the chorion. That's part of the uterus or part of the placenta. Number 2, we had the allantois. Number 3, we have the yolk sac. And number 4, we have the amnion. Those are the 4 extraembryonic membranes. And we included one of the tissues that would also be part of it, no? The umbilical cord, okay? So when you get into the histologic laboratory in histology, you will come across the cross-section of the umbilicus, okay? And it will show you that you have there the gel, no? And inside would be 3 structures. Again, what are these structures, Miss Makamay? What are the 3 structures that you will see when you cut the cord? You are still, okay. Yeah. So as I've said, as part of being the medical clerk or the intern, no, you will have to take the baby, no, the newborn baby, into the nursery or the NICU, and then you inspect the abnormalities or any abnormalities in the baby. One of them would be the umbilical cord. You have to see whether there are really 2 arteries and 1 vein, always, okay? And of course, there's other abnormalities in the baby that you have to inspect, no? Or you have to make sure that everything is normal externally in the baby. Okay, now in this slide, you can see the different implantation sites. Typically, the implantation should be at the mid-uterus. If it is not implanted inside the uterus or intrauterine, then it must be ectopic. So ectopic pregnancy will encompass several types of ectopic. One is the interstitial pregnancy. It is part of tubal pregnancy, but it is on that part of the tube that is that penetrates through the wall of the uterus. So it is 2% of cases in ectopic pregnancy. The earliest tubal pregnancy that would give symptoms will be the isthmus, because the isthmus is the narrowest portion of the tube. Okay? Siyempre, pag mag-rupture yun, earlier part pa ng pregnancy kasi what will make that tube rupture will be the erosion into the tissues of the fallopian tube. Okay, can you imagine in an isthmic pregnancy, very narrow lang yung isthmus. So when the fertilized ovum enlarges and it implants or erodes into the uterine, the fallopian tube rather, so it will have symptoms of rupture earlier than it will have symptoms in the ampullary portion. Because in the ampullary portion, if there is an ectopic there and it's rupture, no, medyo matagal-tagal pa bago siya mag-symptoms kasi it will just, large man yung ampulla. So it will just grow for some more days or weeks and it will rupture later, okay? So that when you meet a patient with ectopic pregnancy and you determine for the age of gestation, pag sinabing 6 weeks lang or 5 weeks and it has ruptured, then think of it as an isthmic or tubal pregnancy in the isthmus. While kung medyo 8 to 9 weeks na, no, and it ruptures at 8 or 9 weeks, then it must be an ampullary tubal pregnancy, ruptured, okay? Sometimes it will also implant in the fimbria, okay? And it becomes a fimbrial pregnancy. Kung ini naman nga fertilized ovum will be extruded out into the ovaries and it implants in the ovary, then it becomes an ovarian pregnancy. Some fertilized ovum will be implanted on that part of the cervix. Cervix, yung kwelyo ng mattress, no? The neck of the uterus. It becomes a cervical pregnancy and it's very difficult to diagnose with cervical pregnancy because it will erode on the cervix and it may appear like an abortion. Okay? Kaya lang mas invasive ang cervical ectopic because it will really the placenta and the implantation would really erode into the cervix of the patient. And sometimes it will necessitate the removal of the whole uterus, okay, because the bleeding will not stop. Now in the section, that sagittal section of the abdomen, no, or the reproductive system for that matter, we examine, huh? Okay. Michelle Garcia. Are you there, Michelle?
Yes, Doc.
Okay. Miss Garcia, okay. Nurse ka o medtech?
Biology.
Yes, biology.
Yes, biology.
It doesn't matter. Okay, look at the picture, no? The picture below the uterine picture. you have there, kasi you have to note for the relationship of each of the organs to the other, no? An organ to another organ, so that you have there the uterus between anteriorly the bladder and posteriorly by your rectum. Okay? So kailangan alam mo yung picture na yan. Alam mo where what is anterior to your uterus and what is posterior to the uterus. So that when you get into obstetrics, you will note na in some patients, for example, may cancer of the cervix, for example lang, cancer of the cervix, no? You can have metastasis into the contiguous organs or what is related to it. Kung ano sapit, what is near the uterus, near ng cervix. So, sometimes there will be metastasis of the bladder kasi, di ba, contiguous lang sila magsapitla. Okay? And sometimes too, there will be metastasis or extension of the cancer into the rectum. Also, sometimes in difficult pregnancies, kasi di ba, imagine the baby coming out from the womb, from the uterus, but it stops there for long hours, especially kung ato baryo, no? Di rin nanganganakin sakto. So the baby nakaungong or the baby is stuck there. And some of the tissues will have necrosis because of lack of blood supply na. Maihan na nga nag-labor. And sometimes there will be some anomalies in those areas. Katapos panganak ng mother, let's say after a week, you will find out that the mother will defecate or the feces or the stools will come out from the vagina. Bakit kaya nagkaganon? Why do you think a mother can have defecation through her vagina?
Fistula, Doc.
Yes. Sino nag-answer nun?
Timbal, Doc.
Dane? O sino?
Yes, Doc. Yes, Doc.
Okay. Timbal? Dane? Okay. So, the patient could have a fistula, which is a connection between one hollow organ to the other. So, from vagina to the rectum. So maybe there could be some erosion because of lack of blood supply. Nagkakamayadahin connection between the vagina and the rectum. So you will have the so-called rectovaginal fistula. And the feces, the stools coming from the rectum can be extruded out into the vagina. So ito nga, after about 6 months, it could be repaired. It cannot be repaired right away because the tissues are still inflamed. So the surgeon will have to repair the rectovaginal fistula mga 6 months later when everything is now normal. Hindi na inflamed. Okay? So this diagram will just show you the different embryonic development, no? So as I've said, you can have mitosis, no? Doubling from 1 cell naging 2 cell, ang 2 cell naging 4 cells, ang 4 cells naging 8, 8 to 16, and it becomes a morula after that. Okay? And as I've said, you have first dito sa hindi na masyadong compact yung cells. But as soon as the cells acquire the number of cells, no, it will compact itself, no, so that the morula becomes compact, and you will have tight cell contacts with each other, becoming it a blastocyst. Okay. When there is now your blastocyst, that is now the time for implantation into the inside or the intrauterine aspect. So doubling or mitosis of the cells, no, is called cleavage. The next phase after cleavage is gastrulation. What can you remember about gastrulation? Janelle Margalio. Ano kaya ang gastrulation? It's in the slide. Now, actually, gastrulation is the formation of the 3 primary germ layers. Okay? So, ano na yan? What are the germ layers that are formed? Janelle Margalio.
Good afternoon, Doc. The 3 germ layers po, the ectoderm, the mesoderm, and the endoderm.
Yes. So, you will have now the 3 primary germ layers called the ectoderm, mesoderm, and the endoderm. And you should know by this time, ano yung mga ectodermal derivatives, no? Ano yung mga ectodermal derivatives, mesodermal, sa endoderm din. What are the organs that will arise from the ectoderm? What organs from the mesoderm? And what organs from the endoderm? Ahmad, Mumtaz, Ayesha. Anong mga organs ang galing sa ectoderm?
Ectoderm.
Embryo. Ectoderm.
Example, Doc, is sweat glands, skin.
So the skin, yes,
Yes
sa
po.
ectoderm yun. And what other organs? Aside from the skin?
Ano po? Sensory organs, mammary glands. The central. Hello?
Okay, so you can have the central nervous system from the ectoderm. You have the peripheral nervous system. Yes, you mentioned about sensory epithelium of the ears,
organs,
nose, and the eyes. Yes, the skin and the skin rather, including the hair and the nails. And of course, you have the sweat glands also. Yes, the pituitary, mammary, and the enamel of the teeth. So ectoderm yun. Yung second naman is the mesoderm. Miss Pagay, Maria Kain.
Yes, Doc.
Miss Pagay. Sa mesoderm, ano naman yung mga derivatives or what are the organs that will be derived from the mesoderm?
All types of muscles, Doc.
Yes, correct. So muscles, muscles from all parts of the body because they come from the myotome, no? Other derivatives will be from the sclerotome. Bali, the cartilage or bones, they come from the mesoderm. And the dermatome, dermis of the skin. So not the whole skin, but the dermis of the skin will come from the mesoderm. Or Mineta, Ayan von Clifford. Ano pa yung ibang derivatives, no? Ano ba ang galing sa mesoderm? Matthew Tan. Matthew Tan? Are you around, Matthew?
Yes, Doc.
Ano pa yung iba na galing sa sa mesoderm?
Those that protect the organs, Doc.
For example, yeah, muscles, yeah. In ano na ito? Other than muscles, cartilage. What do you think about the arteries and the veins? Vascular system. Is it part of the mesoderm? Yes or no lang? What do you think, Mr. Tan?
Yes.
Yes, of course. So, vascular system, including your blood vessels, the heart, arteries, the veins, lymph vessels, the blood per se, and the lymph cells. They will all come from the mesodermal germ layer. And the urogenital system, okay? Uterus, the urinary bladder, they will come from the mesoderm. So tapos na tayo sa ectoderm, mesoderm, then we'll come to the endoderm, germ cell layer. Gwyneth Kate Pastor, are you there? What
Yes.
are the organs that will be derived from the endoderm, germ cell layer?
The GIT po.
The epithelium, yes, of the gastrointestinal tract, because you know the organs of the gastrointestinal tract. We also have muscles, huh? So yung epithelium lang ng gastrointestinal tract, like yung columnar epithelium ng, let's say, of the ileum or the rectum or the stomach, no, will all come from the endoderm germ cell layer. What else? Epithelium, the gastrointestinal tract, what else?
The
Yeah, sige. Yes.
pancreas. I don't.
Yeah, pancreas, yes. That's the parenchyma of the pancreas. Mr. Sugkang, ano pa kaya? Ang endodermal germ cell layer would come from the endoderm.
Thymus po, Doc.
Yes, the parenchyma of the thyroid, the thymus, the liver, okay? And also the epithelium of the respiratory tract and the urinary bladder, okay? So these are the important organs that will be derived from the endoderm. So again, you have to remember those organs coming from the ectoderm, mesoderm, and the endoderm. So ectoderm, the central nervous system, the peripheral nervous system, the sensory epithelium of the ear, nose, and eyes, the skin, including the hair and nails, the pituitary, mammary, sweat glands, and the enamel of the teeth. For the mesoderm, you have the somites, you have the myotome, which give rise to the muscles, the sclerotome giving rise to the cartilage. We have the dermatome giving rise to the dermis of the skin, the vascular system giving rise to heart, the arteries, the veins, lymph vessels, the blood and the lymph cells, and then the urogenital system. For the endoderm naman, you have the epithelium of the gastrointestinal tract, epithelium of the respiratory tract, epithelium of the urinary bladder, and the parenchyma of the thyroid, the parathyroids, the liver, and the pancreas, okay? So this is just a diagram of those, yung gastrulation, the formation of the ectoderm. So outward, you have the ectoderm, then next will be the mesoderm, and the inside will be the endoderm, okay? That is, you should know how it looks like under the microscope, no? During the early parts of the conceptus. Oh, ito na, yung sinasabi ko kanina. Okay? You should have a picture of this in your mind. Okay? Para when mag-exam tayo, alam nyo na how you will answer. Okay? By the way, we will have an exam by mid of November for all my lectures. Huh? So I think today I will end my lectures, and next time, the first Friday of November, we'll have a little review. Okay? Para at least alam nyo. Oh, nakatawa si Miss Makamay. Actually, no, I want all of you to pass embryology, kaya makinig kayo, okay?
Thank you, Doc.
Hindi naman talaga siya mahirap, okay? You just have to understand, and then you have to read your book. Alam niyo yung book nyo? Medical Embryology lang months, okay?
Yes, Doc, lang man.
Oh, dapat mayroon kayo niyan, the latest edition. Yun lang
Doc.
naman. Oh.
Doc, ano ang nga chapter, Doc?
First chapters. First few chapters.
Okay,
And of
Doc.
course, you have to study my lectures. Okay, there are some that will not be found in your book. At saka hindi tayo spoon feeding, ha? This not when you are a student in a college of medicine, it's not all spoon feeding. Para bang UP, ha? Alam niyan ng mga UP students. Oh. I've studied also in UP for 4 years. Ang mga teachers sasabihin lang sa inyo, your assignment is chapter 1 to 20. You read on it. After a few weeks, exam. So dapat alam niyo kung anong examin niya. So, okay, these are the extraembryonic membranes. You have 4, no? Chorion, amnion, yolk sac, and allantois on the lower left side. Okay, and the formation of the germ layers. Moving on. So we have a successive slides, no? Where you have transition of the embryo, okay? So you can have now the fusion of the chorion and the allantois. That's why you have a chorioallantoic fusion, okay? The chorion, as part of the extraembryonic membrane, will fuse with the uterus, no? And it becomes the placenta, okay? It is the part of the placenta, the chorion. So these are now the fetal membranes, the extraembryonic membranes. Yolk sac, which is the early nutrient supply for the embryo. The amnion, we have dealt on this last time. What are the functions, no? Protection of the fetus. It prevents the lungs from collapsing, and it prevents also the fetus from being traumatized, okay? It provides for the movement of the fetus. The allantois fuses with the chorion, carries the blood vessels of the placenta, and it is filled with fluid, okay? The chorion attaches to the uterus, I've said, and it forms the maternal portion of the placenta. There's one structure in the embryo that is very important, no? Because with the formation of the so-called primitive streak, it will divide the embryo into an anterior portion, which is the cranial portion, and the posterior as the caudal portion. With the formation also of the primitive streak, it will divide the embryo into a left and a right. So it could have a right portion and the left portion. The primitive streak extends cranially, then regresses caudally, depositing the notochordal process during regression. The tip of the streak is the primitive pith, and the primitive node, which is called the Hensen's node. So there in that drawing, now you will understand that the primitive streak would be found at the center. Okay, it will divide the embryo into a left and a right, and anteriorly you have the cranial portion, and you have a caudal posterior portion. Okay, so yung importante ng primitive streak. Okay, now this slide is very important because it will show you the successive steps from fertilization to the implantation, okay, of the fertilized ovum. Do you understand? After ovulation, diba? After ovulation, the mature grafted follicle will discharge the ovum, and it will be caught by the fimbria. Fimbria, diba? You know, in the fallopian tube, there's a fimbria there. And the ovum will travel through the whole length of the fallopian tube, but it has to be fertilized at the ampulla. So after it has been fertilized, it becomes a zygote, and then it will travel through the tube until naging 7th day na mag-i-implant siya. Okay? So from there, no, from the fimbria, there's now doubling of the cells. So the zygote, 2 cell states, maging 4, maging 8, maging 16, and it becomes a morula. After that, it becomes a blastocyst. So I will ask you, what phase of the fertilized ovum ang nag-i-implant? Miss Pacoma, Ariel. What implants in the
Hello, Doc.
uterus? Ano?
Is it blastocyst, Doc?
It is the blastocyst, yes. So it is a blastocyst that will be able to implant, okay, in the inside of the uterus, mid portion of the uterus. Supposing nag-blastocyst siya, nandun pa lang siya sa ampulla of the fallopian tube kasi may mga obstructions, may infection, may adhesions. What will happen? Peniranda, Tricia. So in this picture, the normal thing will have doubling, no? Within 7 days, there's doubling and doubling and doubling until it becomes a blastocyst. Supposing there is an adhesion inside the fallopian tube, hindi siya makadaan. Doon lang siya, nag-blastocyst siya sa fallopian tube, sa ampulla of the fallopian tube. What happened?
Ectopic pregnancy po.
Correct. So, kasi at pag nag-blastocyst siya, mag-i-implant na siya. So, kahit meron siyang obstruction, it will have to implant anywhere kung saan siya naka-obstruct, naging blastocyst. Okay? So, that is what it means by having ectopic pregnancy. It will implant not in the normal area to which it should implant. It is implantation outside of the intrauterine portion. Okay. Now, mga nurses din, you have seen the placenta. So the placenta is very important, no? in a product of conception, because there'll be no viability of that baby if there is no placenta, good placenta, okay? Functional placenta. And what are the functions of the placenta? Prehula, Joanna. What do you think are the functions of the placenta?
Exchange of nutrients po, Doc.
Come again?
Exchange of nutrients po between the mother and the fetus.
Yeah, there should be exchange of nutrients, waste products, and respiratory gases between the maternal and the fetal bloodstream. So it is very important, ha? Kasi doon yung exchange of the materials, especially the gases, no? In the placenta and towards the baby. But of course, the gases will not reach, and the nutrients will not reach the baby if it were not for what? James Pretensio. Hindi man nakadikit yung placenta sa baby. So,
umbilical cord po.
correct. You should have, may imagination ka na dapat ngayon. Na yung placenta nakakonect sa umbilical cord, and then the umbilical cord passes into the baby. Sa portion ng umbilicus ng baby, ha? And what is more important also is the transmission of the maternal antibodies to the fetus. So there are several maternal antibodies. And what are the antibodies that you know of? Pedere, Paul Vincent, what are the antibodies that you know of? Different antibodies. Antibody what?
Doc,
Mga antibodies, ano? IG,
can you hear me, Doc?
ha?
Oh, yes po, yung IgA,
IgA,
GM, IgE, and IgD.
IgM, di ba?
IgE and IgD.
Oo. So, ang importante talaga is IgG, which could traverse to the placenta, ha? To the umbilicus. So, importante yung mga antibodies, okay? And this will protect the baby. So, after, di ba, nag-ano na tayo, gastrulation. So, number 1 is cleavage, then you have gastrulation, then you have your organogenesis, no? Sa gastrulation, formation of the primary germ layers. You have 3 primary germ layers. So as I've said, you have your ectoderm, mesoderm, endoderm. Once na-form na ini, you will have the progressive development of the fetus, becoming now, we have now the development of the different organs. Okay? So, ang ito nga, we have sequential ultrasound being done on the fetus. In the prenatal clinic that we have, no, di nila makausa mag-ultrasound. We subject the pregnant woman into several ultrasound just to determine whether there is normal development of the organs, of the external extremities, mga upper and lower limbs, no? Until such time there will be growth and development, no, into mature fetus, no, going to 37 weeks. By the way, ano ang number of weeks of a mature fetus na pwede nag-anak? Zoe, Miss Zoe Kapungkol, what is the number of weeks na pwede nang ipanganak yung baby?
Hello, Doc.
Anong number of weeks?
Can you hear me po?
37 weeks, 37, 38, 39, 40, okay? So we can be sure na mature na siya because all the organs have reached maturity. Pwede na ipanganak si baby at 37 weeks. Hindi na siya premature. But if the baby is still 36 weeks and below, then dapat hindi pa muna siya ipanganak. And what are we afraid of in an immature baby or premature baby? What are we afraid of? Bakit kailangan talaga makalit siya ng 37 weeks? Again, Miss Makamay, what do you think? Yes, because there is such thing as hyaline membrane disease, no? Ito yung number one cause of fetal demise in the newborn. Pag hindi pa siya mature, the lungs will collapse because of there's a certain cell that will produce this one, no? Your mature cells in the lungs, okay? Pag wala ka pa yan, no, the baby do not have this substance, the lungs will collapse and the baby will not be able to breathe. Magko-collapse yung lungs niya, okay? It's called the hyaline membrane disease of the newborns. Okay. So, dapat alam nyo na there is now successive growth and development of all the organs until such time that it becomes mature at 37 weeks. So, I will leave it at that. The last topic that I will talk about is the hormonal control of the menstrual cycle. Okay, so you have to understand na the control of the menstrual cycle is coming from the brain. Okay, so dapat there is an association or coordination of the hypothalamus, of the pituitary gland, the ovaries, and the uterus. Huh? So that's why our patients are coming back to us because of irregular bleeding, di ba? Mga girls, do you have regular menstruation?
Yes, Doc.
Yes, Doc.
Sino yon? Hindi.
No, Doc.
So yung iba
No, Doc.
talaga, di ba? Hindi.
Yes, Doc. No, Doc.
Yes po, Doc.
Pero sabi ng iba. Siyempre may mga joke tayo dito. Ang joke dyan, some patients come to me kasi hindi siya nag-menstruate ng 3 months. So, my question is, may ginawa ka o wala? Di ba? Kung may ginawa siya, matakot siya. Pero kung wala siyang ginawa, huwag siya matakot. Di ba? Did you understand me? Because sometimes, really, there should be an interplay of the hormones from the hypothalamus. What is there in the hypothalamus? The hypothalamus will release the releasing hormones, okay? The so-called gonadotropin releasing hormones, okay? Your FSH releasing hormone or LH releasing hormone from the hypothalamus. And this is because of negative feedback mechanism, okay? Now, it will produce some stimulus towards the pituitary gland. There are 2 parts of the pituitary. You have your anterior and posterior pituitary. So what is induced here is functional now for our reproductive system is the anterior pituitary because you have your LH there and your FSH. Okay? Once na-release ng releasing hormones to the anterior pituitary, then you will have now a rise in the FSH and the LH. Okay. And ito, yung FSH and LH from the anterior pituitary, it will give stimulus to the ovaries. So FSH, what is the meaning of FSH? Follicle stimulating hormone. From the name itself, it will send a signal to the ovaries to develop the follicles, diba? The first 14 days in the ovaries is called the what? Kasi ito yung formation of the follicles. Miss Chua, Daflay. Did I pronounce your name well? Daflay? Chua?
Apa, Doc?
Oo. So, as the name implies, follicle stimulating hormone and luteinizing hormone. It will send a signal to the ovaries. Anong magiging effect sa ovaries?
Ovulation po, Doc.
Come again? Did you say ovulation?
Yes po.
Yeah, that's one part, the ovulation, because as the name implies, follicle is stimulating hormone. That means it will stimulate the follicle to develop, di ba? When you develop the follicle, nagtitikadamot yan. Imagine the follicle, di ba? Made of cells and then habot nga may dahil ovum. So it will not only contain one layer, naging 2 layers, 3 layers of cells, which we call the granulosa cells or your follicular cells. So nagtitikad ako, as you go from day 1 to day 14, your follicle will grow and grow because it becomes layered, several layers until such time on day 14, it will now extrude out the ovum from inside. What is that extrusion of the ovum called? The gami. The gami, Carol?
Yes, Doc.
What is it called? Yung extrusion of the ovum during the 14th day.
Follicular phase.
Amot yet ovulation. So, ang isang babae could only get pregnant when there is ovulation. Pag hindi lumabas yung egg na yan, hindi siya ma-fertile. Yan yung the very egg that is caught by the fimbria na magkakaroon ng relationship dun sa sperm. Di ba? Pag wala yun, walang pregnancy. Okay? So, during the growth and development because of SSH, FSH, and LH, the first 14 days, palaki ng palaki yung the follicle, and once it reaches the 14th day, pag malaki na siya, mag-extrude out ng ovum. So that time, pag extrude ng ovum, pag mayroong sexual contact, there be fertilization kasi nag-ovulate yung si babae. Okay? So it is called, the first 14 days of the ovary is called the the follicular phase. There's formation and growth and development of the follicle. So the next 14 days after ovulation is called kasi converted yung follicle into the corpus luteum, di ba? Yung follicle, once na wala ng egg siya doon, magko-converted into a corpus luteum. So we call the second phase now as the luteal phase. Okay, so first follicular phase, yung next 14 is the luteal phase. And it will have a different effect on the uterus kasi magkaiba yung hormone na ma-detect sa bloodstream. What is elaborated during the follicular phase? What hormone is elaborated by the cells or the granulosa cells? Anyone? Dalawa lang yung pagpipilian mo. Progesterone or estrogen?
Estrogen po. Estrogen.
Estrogen, yes.
Estrogen.
Okay. You
Estrogen.
memorize the graph, okay? The graph, di ba? First, yung hypothalamus sa taas. Next is the pituitary gland. So you should know the hypothalamus will release the hormones, releasing hormones, and then it will send signal to the adenohypophysis or the, you call this the anterior portion of the pituitary gland to release LH and FSH. First part ito ha, first 14 days. And then it will now grow, it will now cause the growth and development of the ovum, or rather the follicle. That's why you have there the first 14 days as the follicular phase. And then yung follicles na yan, or the granulosa cells, will produce a certain hormone, estrogen. Okay. After ovulation, mako-convert yung follicle into a corpus luteum. So that's why the next 14 days after ovulation is called the luteal phase because of the corpus luteum. And the corpus luteum will now secrete another hormone. Estrogen, progesterone?
Progesterone, Doc.
Progesterone. Okay. So you can only have adequate amounts of progesterone pag meron kang corpus luteum. Tingnan mo ulit yung diagram, yung may mga drawing ng follicle, di ba? Follicle, di ba? Okay. The first part, day 1, 2, 3, buti ay pat follicle. You have primary, secondary follicle. And until such time, it becomes a mature Graafian follicle. And then on the 14th day, mag-release ng egg. It is called ovulation. The follicle without the egg will now become a corpus luteum. Okay? And later on, you will see a corpus albicans. You have hyalinized corpus luteum, it becomes a corpus albicans. So yan, ang importante lang sa diagram na ito. And then all of this, no, because of the hormone, you will have a different effects on the uterus. So, pinaka-last drawing at the base will be the tangential or sagittal section of the uterus, the lining epithelium of the uterus. Okay? So you will have the so-called proliferative phase in the first part of the menstrual cycle. So pag hindi pa siya nag-ovulate, yung uterus or the uterine epithelium, no, will be in the proliferative phase. Nagpo-proliferate pa lang yung yung thickness niya. You will see that the glands are straight. You will have shorter arteries, okay? Non-coiled arteries, straight glands, and it is thinner pa yung uterine wall, okay? Or uterine lining. Then after ovulation, see sa book na the center is ovulation. After ovulation, you will have now production of your progesterone. It will now convert that uterine lining into a secretory phase. Secretory phase meaning thickening now of the uterus. You will have coiling of the glands, also coiling of your arteries, okay? Because of the hormone progesterone, okay? And after a few days, no, or before, let's say 2 to 3 days, or a day before menstrual period, there will be a decrease in hormones, decrease in estrogen, decrease in progesterone. And this will now herald the desquamation. So wala nang hormones na mag-hold ng uterine lining. So the uterus will now go into menstrual period. So in a woman with a 28-day cycle, yan, nagme-mens siya every 28 days. In the non-medical parlance, for example, common tao, no? Joke na naman ito. Nagtutuok et uterus after 28 days. So, amo ito nagme-menstruate. Kay kuno, the uterus na-depressed or was disappointed. Kay waray man implantation. wala man fertilization. That's why nagtutuok, nag-menstruate because there was no implantation and no pregnancy that's occurred. Okay, but in reality, you have menstrual period because of the downfall of the hormones. You have a downfall of your or decrease in estrogen and a decrease in progesterone. Now, in some women na hindi sila menstruate because wala silang progesterone, pero nila estrogen, walang ovulation. And you are sure with women na their menstruation would not be normal, they come every 4 months, that they are unovulating women. They cannot be pregnant. And so, yun, hindi sila nagme-menstruate. At wala naman silang ginawang masama or mabuti, whatever. Okay, did you understand? You can only have a regular menstruation if you have a good interplay of the different organs, no, from the brain down to the uterus. There should be an interplay of your hypothalamus, your pituitary, the ovary, and the uterus. Dapat there should be interrelated hormonal play of the different hormones from the different organs that are involved. Okay, I think that would end my lecture today. Next time, we will have a brief review, and after that, exams na. Any questions?
Doc, may doon na schedule sa not exam it embryo?
Actually, we already have I'm not really sure, pero from 12, November 12, I think. I'll be in contact with the class president.
Durungan, Doc?
Ha?
Durungan yung subjects?
Oh, di ito durungan subject. There's a schedule actually. Di pwede nga one day tatat nga subject. I think it will not be.
Bakit alas 10 gabi mahuman, Doc?
I think I say we will have an online. Hindi lahat ha, hindi ko lang alam. I think in histo baka wala. Wala muna. May ba kita histo?
12 ko no, Doc. Mag-exam ko no.
Yeah, correct. Yeah, ngayon, naghatag ng instruction ni Doctor. Okay. So, I will not schedule the embryo with your histo.
Thank you, Doc.
For
Thank
sure.
you, Doc.
So, mag-review na lang tayo next time, ha? During my class in embryology. Okay?
Doc, sure na ito nga canvas at exam, Doc?
Yes, sure na.
And ano mat settings ito, Doc? Like, on it microphone, on it camera?
I'll give you to Shasha. My question here about it exam. IT ha, because I cannot answer mga questions for the IT. IT at maaram. Kadali la ha?
Okay po, Doc.
Ganito, histo. May question here.
Hello, good afternoon.
Hello, Ma'am Sha. This is Bargamento po, batch PIO po. Ma'am, since online kita hit exam, ano po setting ito? Like,